This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.
Talk Radio 1210 WPHT, WPHT HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch.
Good morning and welcome to another edition, another time. It's always a good time to get healthy. Health Watch is the show every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly FANTASIA is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. I'm your host, John DeMasi. Together, we will bring you a show that will just make you healthy. That's our mission statement here. 855-839-1210 is our number here in the studio, 855-839-1210 at any time during the course of the show. If you have a question or a medical challenge that you want to run by Dr. Molly, feel free to call in, and Dr. Molly will try to help you out. 855-839-1210. Interesting, Dr. Molly, a friend of mine called me this week and said, I just heard your commercial. All right.
Okay.
And he said, it reminded me to call you. By the way, does that stuff work?
Yep, I knew that was the question. Okay.
It's a consistent question. So just talk a little bit about what you do.
John, I think it is a very difficult concept to comprehend. But the bottom line is that what we do over at Integrative Medicine is we actually are a group of like-minded healthcare providers who can do anything you can normally do in a primary care practice. If you need a prescription, we can write it. If you need a medication, we can deliver it. If you need radiology, we can send you out for it. We have a list of specialists that we use within the framework of the practice, and we can manage your care any way that a primary care facility would do. But it's our philosophy that really separates us from the crowd. And the philosophy is we want to use the least amount of the pharmaceutical that we can in order to effectuate the change, keep your quality of life, and not have you really have a problem with the side effects of both the condition and the medication. And how do we do that, John? We use hydration. And
hydration, of course, is the cornerstone of your
what
practice.
We do, yes.
Right. But when it comes to the hydration,
yes.
Are people concerned about that? Or
Sure. I mean, look, hydration's been around for many years. You go into the emergency room, the first thing they do is insert an IV because it's a great way to deliver medications because it's a direct hit to where you want to intervene in the problem. So the same is true for what we do. We use vitamins, minerals, and mostly God's ingredients in order to effectuate the change for the patient. The question becomes, why does it work? The direct availability of the particular substance in order to effectuate the change that we're looking for. And again, hydration in and of itself is a medical modality.
And, everybody does ask that question, does it
Oh,
work?
every day, every day, 2 times a day or more.
Right. All you have to do is sit in your facility and see, there are tons of people. You are so busy.
Well, that is true.
The question would seem to me that there's so many people getting this done, it's got to work.
Right. Here's the thing, John, you've been with our clinic for a very long time.
Yes.
The biggest thing now that I'm running into is that people say, well, how long do I have to come? I said, well, how long do you have to take your medications? Right? Okay.
Yes.
Till the problem's resolved, right?
Yes, yes.
And that's the same is true for hydration. In other words, what we see is that we can effectuate the change in as little as 5 weeks for some people, but it may take 30 weeks for some other people, depending on when you come into us for your challenge, right? If you come in the beginning, obviously we can help you move along in that continuum in a way that works for you more quickly. But if you come in and you're stage 4 of whatever type of challenge you have, like cancer or something, obviously it's going to take a little longer for us to get you back to having some kind of quality of life.
I know this is a hard question to answer, but the standard as far as how many treatments?
I
What
would
is
say
it?
as
10?
little as 5, but as many as 30 or 40 if need be. And again, it's going to depend on what we're trying to correct. What are we trying to do for the patient? Ultimately, we have one goal in mind. The goal is to improve their quality of life regardless of what drove them to see us. And in doing so, hopefully, reevaluate the challenge that they have and maintain a good quality of life as they go on through whatever continuum. Whether they want to pursue traditional medicine, we don't have a problem with that. My doctors are traditional, right? I mean, they were trained in medical school.
Right.
My nurses were trained in nursing school. We are very, very much a medical hydration facility. And we treat our patients like patients. They are not clients to us. They are patients.
You know, it's interesting because I just think about all the people that I've seen that have come through your door, and there's a lot of people that you've helped over the years.
We try.
Really, it's a tremendous accolade to you and your
Well,
staff.
I give the credit to the man upstairs, okay? He's the big, as I always say, he's the big doctor. He is it. He is it. If we put our trust in the good Lord and we put our trust in each other in terms of, making sure that we utilize everything we can to help a patient. And again, we subscribe to this theory of do no harm. We don't want to harm anyone. We want them to come out of our facility feeling good about themselves, and more importantly, seeing the evidence that the things we are doing are helping them maintain that quality of life.
Are there any side effects with nutraceuticals?
Sure. One thing I ask all the time, we want to make sure the kidney functions the way we deliver. We want to make sure that we're able to deliver the fluid, right? Obviously, there's an art to this. Somebody coming in with congestive heart failure, and we worry about fluid overload, right? We're not, we're traditionally trained. I'm traditionally trained.
Yes.
So we look at that and we say, okay, how do we work their particular treatment protocol? And that's true across the board for everyone. We're always individualizing the protocol. So there could be side effects. Are you allergic to something, an ingredient that we might be using? We want to know that. Generally, I can tell you in 27 years, the most common side effect that I've seen has been a reduction in the blood sugar. If people don't eat before they come in or don't snack while they're getting their IV, then therein lies the problem. But nothing really more serious than that.
Have you ever, or do people ask you, are there more side effects with prescription meds as opposed to nutraceuticals?
I want to say this. I want to say it's always called risk versus reward.
Yes.
That's the key. And that's the key, I think, in good science. We have to look at the risk with some of the medications versus the reward they do. We are not against medications, folk. When you come into us, and if you're on a series of medications that is needed for your condition, we're not going to tell you to throw those all away. We may help you reduce one or two of them, and that would be the objective that we might do. In other words, it might not be enough to just say we're going to improve your quality of life. We may help you get off one or two of your meds, but we're not going to tell you to throw them away. You've got to do that under the guidance of our team.
So there are side effects with both.
Of course, but
it just
again,
depends.
it depends. I mean, you've got to look. People tell me all the time, "Oh, I can't take these nutraceuticals or these natural products. They upset my stomach." Well, did you ever take aspirin on an empty stomach? What happens? You have a side effect.
Yes.
So there's always side effects. You can't say there's never any side effects. The idea is, from my perspective, in terms of our facility, we are prepared for any side effects of major consequence, period.
You believe in the least amount of pharmaceuticals necessary.
Right, exactly.
And why is that?
Because, again, when you start mixing a whole lot of drugs together, don't you think you may have actually cause more side effects than the condition itself has caused? So we want to be able to weed that out, right? It's
Yes.
not your condition, but it's the medications. And how many times have you gone back? You're a good example of that, John. You had a situation with a blood
yes.
pressure med,
Yes.
and we kept saying, we think that, that's not a good med for your genetic type,
Yes,
right?
yes.
And what happened?
Yep.
You got off of that. We were able to reduce the dose of another med, and you're doing fine.
Yeah, that's true. Boy, we went through. I mean, we probably went through 6 or 7 different.
Well, because your doctor wasn't inclined, the specialist wasn't inclined to listen to us, but ultimately he capitulated.
Right.
Because, again, I'm going to tell you this. Most physicians do not want their patient to suffer through a treatment protocol. They don't. I mean, really.
Yeah.
But, of course, you got to understand they're pretty busy. They can't always keep up what's going on in the natural world or the science. And even in the science, in terms of the traditional medicine, they're not always up to par, because you got to look at it differently. I'm a researcher, so I'm always looking at what's brand new and how good is it.
Your wheels are always turning.
Amen.
I always say that. Hey, we are coming up on our first break of the morning. It is Health Watch, Sundays 8 till 9 here on Talk Radio 1210 WPHT. I'm your host, John DeMasi, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Have a question for Dr. Molly, or you want to run by her medical challenge that you're having? 855-839-1210 is the number. 855-839-1210. We are both coming back with more of today's Health Watch after these words. Operators are standing by right now at Innovative Medical Associates, and if you would like to call and make the appointment for the initial consultation with Dr. Molly, feel free to do that. 856-489-0505. That's the number. 856-489-0505. Call and, like I said, schedule that initial consultation with Dr. Molly. It is complimentary, and you will learn a lot. Trust me on that one. You will learn a lot. The website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. Our show is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. We're going right to the phones. Let's talk to Scott in Sewell, New Jersey. Scott, good morning. You're on Health Watch with Dr. Molly.
Hi, Scott.
Hey, good morning, Molly.
How are you?
Yeah, so I'm okay. I was diagnosed last year with stage 4 prostate cancer.
Oh, boy.
So I've had chemo, and I've had, right now I'm on hormone therapy. It's called darolutamide.
Okay.
And anyway, I wanted to find out, talking to a couple people about you, and I just wanted to find out the possibility of what could be done.
Oh, boy. We can do a lot, Scott. God bless you. God bless you. That's a heck of a... How old are you, my friend?
64.
You're a baby. Yeah,
Jeez.
definitely come in and see us. Come in for the free consult. I really like to get a good history of how this was found. Did your PSA go up exponentially, or what happened?
Yes.
Yeah.
So basically, doctor found it, and it was I was at 64, and by the time they got to it, it was 260. So.
Oh my goodness. Yeah. Okay. So you did listen. You will hear me say all the time, we are not against traditional treatment. You needed to do this, and you needed to do it fast. So God bless you for doing that. But there's a lot of things we can help you through this, because even the hormone therapy isn't a piece of cake. I know that. Just from dealing with a lot of the patients. I think we can improve some of your quality of life. Certainly, come in and see us. There's a lot to do, and the idea is we don't want this thing to come back, and we don't want this to go to any place else. That's the bottom line. Right. And there are many things you can do. You're going to really, I think, today's show, when we get to the meat of the show a little bit, we have another caller right after you, but we're going to be talking about inflammation. And believe me, that is the devil. Inflammation is the devil.
Okay.
Because you got to keep it under control, my friend, under control. Please call the office, Scott.
Yeah, make that call,
I want to spend
Scott.
time with you. I definitely
make that
will.
call, and you can do it right now. Okay?
God bless you. God bless you, my friend.
Thanks for the call.
Bye-bye.
Bill in Wildwood Crest.
Hey,
Bill,
Bill.
good morning. You're on Health Watch with Dr. Molly.
Hi, Bill.
Hi, Molly. How you doing this morning?
Good. How about you?
Yeah.
Good.
No, not too bad. Currently getting my steps in, and I was listening to you guys on my phone. So
God bless you.
And first-time listener to you, and, you kind of piqued my curiosity. So
Okay.
Currently I'm on two meds,
Okay.
a statin and a blood thinner. About 12 years ago, I had a DVT and a PE. So from what my doctor tells me, I'm a lifer on the blood thinner.
Yeah, which one does he have you on? Can I ask, sir? Which one?
Yeah, the most expensive one, Xarelto.
Yeah, Xarelto. Okay, the newer stuff, which is actually, if you had to be on one, that's, even though it's the most expensive, it seems to be the one of choice right now for cardiology who have a brain in their head, because it has less. It really has less side effects than some others, for sure. You know, in terms of going out of control for the bleeding, whatever. You know,
Right.
so you don't have to continue
for me,
the testing.
It worked better because they had me on the other blood thinner. They had to get the blood work checked, they couldn't regulate me, and then your diet affected it. So when Xarelto came out, it was like the best thing for me.
I believe it. But definitely we can help you. We can certainly help improve your quality of life. I got to tell you, I respect you already. In weather like this, you're out doing your steps. So I know you took this very seriously. Very seriously.
Oh, absolutely.
Absolutely. I will tell you, and, you know, I had a nurse, God rest her soul. She just recently passed away. She was my nurse, Barbara. And she had her first problem, like you did, with the blood clots, etc. When she came to me when she was in her 60s. She had just retired from the state of New Jersey as a survey nurse. She came to me. She lived here. She lived with me, worked side by side with me, trained another nurse who now is my nurse in the office. I got to tell you, she was great. She passed away at 89. So listen to me. It can be done, okay? And she was a believer, boy, in what we did. Right, John?
That's right.
Oh, my God, John.
Oh,
come on in. I think you will have an eye-opening experience when you see how many physicians we treat, okay, that don't want to talk about it, and how many nurses I have who become believers and actually are still working in a hospital setting, working with me part-time, and actually encourage their patients to come to us, okay? It's unbelievable. Please do. Please do. I know we can help you and get that quality back, buddy.
Now, question for you, Molly.
Sure.
Is there a possibility that I'd be able to come off the blood thinner at all, or you think I have to go to
I would tell you
dosage?
that, you might be able to go to the lower doses. And listen, you know what else? We're going to talk. We will talk with Dr. Casca, Dr. Pat, who's my medical director, who is a genius with medication, and she was an anesthesiologist for 20 years, so she knows her way around medications. Believe me. We'll talk about it. In fact, we might even be able to talk about, if you come in on a Tuesday, we'll be able to talk about it with her right then and there. Okay?
All right, Bill.
All right.
All right, I appreciate that. Thank you, Molly.
Thanks for the
God bless
call.
you. God bless you, my friend. Take care.
You know, you should mention that you've been able to do that in
I
several
have.
cases
Yes,
where
yes.
you've reduced their medication.
Right.
And sometimes they get off it.
Sometimes they do, or what we do is, and you can. There's an interesting thing, I should tell Bill, right? An interesting thing is that there are natural substances like nattokinase that can be put in when you safely reduce, but you cannot do that on your own. You need to be under a physician's care now. Don't be crazy, folks. It's just because you're on the blood thinner and you run out because you heard Dr. Molly mention nattokinase, please don't just go out and do that. We need to work with you and work carefully. You want to do things right.
You know, you should never stop any medications.
Right. And you know I'm 100% on that track. You know that, John. But
right.
If we can help somebody, we will.
855-839-1210. That's the number here in the studio, 855-839-1210. We're going to start this discussion, but we're coming up shortly on a break, and then we'll pick it up after the break. And if we get some calls, of course, we take you first, 855-839-1210. The New York Post.
Yes, I have a new article.
And I like this word. You're going to tell us what this means. Inflammaging.
Inflammaging. It's going to be a very interesting discussion, and I want to thank my wonderful neighbor friend who listens to our show and made sure I got a copy of this. And this was in last week's edition on July 28th. So this is right in the New York Post, people. You're going to love this article.
And it's talking about anti-aging supplements and et cetera.
The connection between inflammation, cancer, inflammation, and disease, and aging, and new treatments that are already arriving. But I want to talk about some old treatments that have been around for a long time that may help someone actually stop some of these conditions in their tracks.
And again, you use repurposed medications?
Oh, yes, we do. Yes, we do. Repurposed medications. I know, big fancy name for using them so that the doctor uses them, not necessarily for what they were initially approved for, but off-label.
855-839-1210 is the number here, and we're going to take the break a little early here. It's actually the halfway point of the show. But I'll tell you, it moves quickly. It's Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. Again, our number here in the studio, 855-839-1210, 855-839-1210. I'm your host, John DeMasi. Dr. Molly and I return with more of today's edition of Health Watch after these words. As always, when we're here on the radio, operators are standing by at Innovative Medical Associates, and they're ready to take your call at 856-489-0505, 856-489-0505. When you call, very simple. Just make the appointment for the initial consultation with Dr. Molly, and it's, as I said, it's complimentary. It's as simple as that. 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com. That's the website. And our show is Health Watch every Sunday, 8 till 9 here, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here and ready to talk to you. 855-839-1210 is our number here in the studio. 855-839-1210. All right, back to what we were starting to talk about, right. Inflammaging.
Inflammaging. Okay, so that sounds crazy, but it's a brand new term that was coined, okay, by scientists who were studying inflammation and its effect on aging. However, they realized that after the age of 40, looking at the body parameters, etc., something I knew for a long time, and it's all about perspective. When science, it's all about perspective as well as facts, right? How do you approach a subject? Well, this was done as looking at inflammation that cancer causes. But what we're finding out is that you can have inflammation on a micro level all your life. You can have inflammation on a micro level, meaning it affects microcirculation, it affects various systems, but it's very hard. It's subtle, but it's there. So inflammation can be good, right? If you cut yourself, if you're in a trauma, inflammation, if you get a virus, right? Inflammation turns on your immune system, things go in, get rid of the virus. But why is it that people, when they're over the age of 40 or 50, maybe even 60, they have a harder time getting rid of, like COVID was a good example. It took people who were a little older a little longer to get rid of the COVID virus. That's because the changes we see, particularly the body has more difficulty damping down the inflammation caused by the vector, meaning the trigger, if it's a virus or whatever. So really, scientists were looking at inflammation in cancer because cancer is an inflammation process. Cancer itself can give you inflammation. But now maybe the idea is you're always ripe for that from the very beginning. You had some form of micro-inflammation going on before you got cancer. And that's something I truly believe in, which is why I believe that our type of process, meaning our protocols, help people. Not just through the cancer, but to help us maybe tone it down.
You said something about inflammation. In other words, we can have it and we don't know we have it.
Well, we should have it because if you and I go out and you cut, I see you have a cut on your arm right now. You have a bandage on it, but it stopped bleeding, right?
Yes.
Well, that was inflammation process helped it stop bleeding. So we need to have inflammation. But the question is, why doesn't it turn off? Something affects the body and it goes into overdrive, right? And that's when we run into trouble. If you remember what I spoke about last week, chronic inflammation, POTS, certain autoimmune diseases, that's chronic inflammation.
And there's good inflammation and bad inflammation?
That's right, exactly. We need it. God gave us a wonderful protective mechanism to go after our white blood cells, go after things like bacteria, viruses, etc. But what happens when the inflammation is present in the body before or after cancer diagnosis? Does it affect all kinds of systems? The answer to that is yes. Yes. It's not just the cancer itself. We have to look at the inflammation process that might have caused the cancer, and maybe, just maybe, you had it on a micro level, and most people are not testing for it. They're not looking for it. But a clinic like ours, a facility like ours, looks for this, John. We run inflammation markers routinely for patients, and they're out there. We have them.
Yes,
right?
I know.
You've seen it. C-reactive protein is one.
So when you're talking about inflammation, and you've said there's good and there's bad.
Yes.
So how do you know, and how do you get good inflammation and eliminate bad information? This is what I'm thinking.
Yeah, I agree. I agree with that, and that's difficult, but it's not impossible. Okay, let's look at this from the perspective of people who come into our facility who say they're perfectly healthy. They have no problems, right? Now, that's rare, but I've had them come in. I've had no problems, all right? And we run certain blood tests. We run certain genetic testing, and we find out that they may be more inclined to have a particular problem, or they may have a little genetic dysregulation on something, and then they get an exposure. I don't know. They got COVID. Why am I seeing so many post-COVID patients? Why can't we damp down the inflammation that has developed post-COVID? COVID was in your respiration, right? It was really lung disorder.
Yes.
How come these people are coming in with joint inflammation? Huh?
That's a good question.
Right. It's a good question because we couldn't damp down their inflammation process. And I would venture to say, now this is a hypothesis, folks, so don't hang me on this, and don't have 5 of the most wonderful scientists in Philadelphia call me and say you're nuts, okay? But I'm going to believe that we suffer from microinflammation all the time because we're always exposed to something. I believe that. We go out, the kids cut their hands, you get a bruise. That's inflammation. That starts an inflammation process. When it goes out of hand, what happens? Something like COVID virus, which is pretty difficult, and then you add age, just age related to that. What do you think happens, John? You have a multiple facet inflammation. It affects other areas.
Do you have a cure?
Well, I won't say I won't have a cure. I don't have a cure, and this is what the scientists. Let's talk about that. This is the scientists are working on the new drugs that may do inflammation. Everybody knows with cancer therapies now, they do more and more immunotherapies. They're actually working on our immune system, which is the heart of the inflammation process. So we see more and more of that. So the question is, they're looking at things that are anti-inflammatory for them, and there are drugs out there that can do that. And actually, if you think about it, there was an old drug out. It was called aspirin. It's highly anti-inflammatory. So they're looking for new drugs right now, and that's a good thing. I'm not saying it shouldn't be done, but what I'm saying is God has given us so many of anti-inflammatory substances that have been around for years. And the question is, can you augment them? Can you bring them into a patient and effectuate a change in their inflammation status? And I would say yes. And using them in combination with repurposed drugs in many times. For example, we use low-dose naltrexone. Naltrexone is something that is used for opiate reversal. But we have used this in many autoimmune diseases along with the intravenous protocols. And boy, have we gotten good results. So, yes, it can be done.
Talk about curcumin.
Oh, my gosh. Curcumin is one of the favorites. Curcumin is an anti-inflammatory, and it's actually on the top 10 list of anti-inflammatories. So it's found in spice, right? And people know that this has been around, especially if you like some spicy food or Indian food, whatever. But curcumin has many properties, okay? It has a positive finding on gut health, even protecting the intestinal mucosa and improving intestinal integrity. That's very important. It's how you use this, okay? It blocks certain enzymes. It can help with the cytokines. And by the way, cytokines and enzymes are some of the things that can cause inflammation. They start and they move our cells around. That's a little complex. It has to do with pathways. I don't want to get into it, but I can tell you that curcumin, the anti-inflammatory properties have showed a positive effect on this by blocking some of these bad substances. So oxidative stress and free radicals, it has an antioxidant effect. And we also have a good friend in vitamin C who does very similar work in that area. But what I found interesting was all the data on curcumin and brain health. So they're doing so much work right now on curcumin, and because it can penetrate the blood-brain barrier. It can go after the amyloid plaquing that is in the brain that we believe is a characteristic of Alzheimer's disease. And it shows promise in actually inhibiting the formation of tau proteins, which, by the way, I want to say there's a test out there, folks. You can do a traditional lab is running a test on these tau proteins that could give us an inclination of whether a patient may be at risk for Alzheimer's disease.
How about that?
I'm telling you, and I'm big on that. We use it in our facility. When people tell me, I'm very forgetful, I'm doing this, I hope I don't have dementia, I say, well, let's look and see if there are some proteins up there that are causing inflammation in the brain.
Should people go out and buy curcumin as a supplement?
Well, I'm not going to say there are good curcumin supplements out there, of course, but isn't it wonderful that I'm able to deliver this in a hydration protocol? And believe it or not, it supports heart health. I mean, there's just so much with one of these God-given things. I got to tell you, I believe it was in the Garden of Eden. I'm telling you guys, I'm telling you. And it can actually help with various types of cancer protocols, breast, colorectal, prostate, lung, and pancreatic. Has shown promising results with curcumin, along with some of the other things that you do when you have these cancers, right? The chemos, the immunotherapies, that kind of thing, and has really helped the patient improve their quality of life while going through the traditional treatments.
We are coming up on our final break of the morning, which means you still have time to jump in here with a phone call or question for Dr. Molly. 855-839-1210. That's the number, 855-839-1210. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates located in Marlton, New Jersey. And I'm your host, John DeMasi. Dr. Molly and I are coming back with more of today's edition of Health Watch after these words. We are back here on Health Watch, and operators are standing by right now at Innovative Medical Associates. And the number, 856-489-0505. Again, 856-489-0505. They're standing by right now. They will be there well after we leave you on the radio at 9 o'clock. So, in fact, they'll be there all day, 856-489-0505. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. Our program is Health Watch every Sunday, 8 till 9 here on Talk Radio 1210 WPHT. Again, the number here in the studio, 855-839-1210. Still have some time to jump in here with a call, question, or a medical challenge you want to run by Dr. Molly. 855-839-1210. Before we get back into this, I know you wanted to mention the Alliance for Natural Health.
Right. Again,
why is that important?
Well, it's very important because it's a group. It's a lobbying, not-for-profit lobbying. And by the way, I'm a member of the Alliance for Natural Health. I'm not on the board of directors or any of that, but I truly believe in the mission because they're trying to make sure that folks have freedom of choice in their health sovereignty. You really need to think about that, folks. So what's happening is one of the senators, again, he had sponsored a bill before that. The Alliance for Natural Health was very instrumental in getting the FDA out of certain supplements, okay? But what he's doing now is he's sort of backdooring this. The FDA is trying to relieve a bill that would strip the FDA of its responsibility for food and supplements, handing them a new agency. Can you believe this? A new agency to go over
just
this.
What we need,
Federal
right?
Food Agency. Well, you can be sure that many people in the natural health industry and many people in the medical industry, believe me, in healthcare in general, don't like the FDA today. Well, we think that the FFA might even be worse. So I'm telling people, please go on the Alliance. Please look up this thing about the FFA. Look at this, and if it's in your heart to help, just say we oppose this potential bill. That's all.
Okay, 855-839-1210 is the number here, and we want to wrap up this discussion of inflammation and supplements and curcumin and all that stuff.
Right. Well, one of the things I want to say, there's over 500 citations that I was able to readily find about natural substances and inflammation, whether the inflammation, chronic inflammation, whether it has ultimately gone into a disease state or not. And again, I want to caution people, right? Low-grade chronic inflammation is a constant low-level type of inflammation that can persist for months, days, even years. And it is linked to most clinical disorders. So you get the exposure, you have the acute inflammation, which you need to get rid of the bacteria, the virus, or whatever, or close up the wound. But you're left with that low level that can be detrimental, and that's one of the things these new researchers are looking at in terms of cancer, hence the new name, INFLAMAGING, because they know that the older we get, the harder it is to really come to terms with inflammation. The body just doesn't work as quickly as possible to damper down the fire. I call it fire. As you know, I say it's the devil and it's a fire. And there are many things out there. We use many things. I want to also tell people peptides. There are certain peptides, and you've heard me discuss peptides on this show before. Peptides are not the devil. If used properly, you can really utilize those to help dampen down inflammation. They're just not for muscle heads, folks. That's the thing. I always get, you're helping those muscle heads, Dr. Molly. No. There's a real reason to use peptides in integrative medicine. And indeed, I want to tell people, if you use them right, you can help them with their inflammation.
Is there a percentage that you should have of inflammation, let's say, in your body?
I think the idea is, look, if you have an exposure to a particular disease vector, you sure better have some inflammation. You better have a tuned-up immune system. The idea is, if you have this infection, if you have this problem, you just don't want inflammation to go on after the problem is resolved. Once the bacteria and the virus is gone or the trauma is over, you want your body to go back to what? A thing I always tell you about. Goldilocks. Just right. Enough of the inflammation properties in our immune system to keep us healthy, not to put us in a disease state.
We have a caller. Our good friend Germantown Joe is on the line. Joe, good morning.
That's Mayor Joe. How are you? How are you, sir?
Hi, John.
How you doing, Joe?
I want to give a quick shout out to Frank from the Northeast. I just want to say real quick, I love you, Dr. I got it, Wham. I'm on the phone, Wham. Yeah. Dr. God, I take. Anyway, Dr. Molly, here's the deal. I appreciate you being a member of the National Alliance, because you know why? Because you like both my doctors. One is a internal medicine doctor, and one is a family medicine. Both of them are members of the National Alliance for Health.
Great. Great. They are very thinking physicians. I would love to know them. God bless them.
And they'll meet you one day, Doctor, because it's so important that people have a choice, like you said, because you got certain people in this country, in the pharmaceutical, they want to, because remember, this country is a nation of not dealing with the prevention. It's a nation of drugs. They want to just push people on drugs. And like you said, Dr. Miles, you mix it with the right natural supplement. Sure, like I said, we don't tell people not to take their medicine, but to sit there and make that the end all to everything when you should be talking about prevention. Like you said, you have a good health plan, eat right, everything.
Right.
It can prevent a lot of these ailments and disease. That's why I applaud you, Dr. Molly, for doing what you're doing.
God bless you, my friend Joe. God bless you. You're the kind of patient I love. God bless you.
Thanks for the call, Joe.
Thank you, Joe.
Appreciate it.
Thank you.
We want to give some updates on patients.
Sure.
I know you have a patient who had
GI issues.
GI,
yeah,
yes.
yeah. He has Crohn's disease, chronic inflammation. So we sent him home. He came from out of town. He spent a couple weeks with us. We thought we have the inflammation under control, but we were a little concerned that he left a little early. I just spoke to him yesterday, and he said, Dr. Molly, I'm having a little bit of problems. Not as bad as I had before I got to you. I said, look, Joe, you need to get back. And he said, I do. I'm just wrapping up a little bit of business, and then we're going to come back out. And that, I think, is an important point. In other words, this kind of stuff doesn't work in, like lightning. It doesn't, yes. Okay? It is not medication. It has medication properties, but it is not like taking a synthetic type of situation and masking your challenge. What we're trying to do is help the body heal itself and not put the patient at risk.
So he's coming back, and what's the
I think
prognosis?
what we want to do is we have to tune him up nutritionally. We want to take some tests. We want to see where he is in his particular continuum of care, and we want to possibly have him consult with a GI specialist while he's here.
But he's making progress.
Absolutely.
Okay.
Absolutely.
And we have another patient. You want to talk about Joan?
Oh, Joan is doing great. Everybody knows Joan because I spoke to her because it was her radiology oncologist who called me from up in a very prestigious area in North Jersey, big institution. She's really going through, she finished the radiation for the brain cancer, and when she went in for the CT, all of those have been reduced. There are 2 spots on her liver that was there prior, and now they're in a position to do a liver ablation, and that's also done with interventional radiology. The doctor said, gosh, Dr. Molly, you still have her in great shape even through the last set of radiation, and I'm glad that we are. And she looked great. You saw her this week.
Yeah, I did see her, yes.
She looked great. She has a great attitude, and that's the thing I want to impress upon people. Cancer doesn't have to be a death sentence. We want you to have a quality of life through your cancer journey.
And her prognosis is
it's
good.
Pretty good, yeah.
Okay.
I mean, listen, cancer's a beast. If you can get it out, get it out.
That's
folks.
right. And with that, we're going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by right now at Innovative Medical Associates. And the number, 856-489-0505. That's 856-489-0505. And don't forget, if you missed any of today's show or you just want to hear it again, check us out, 4 to 5 this afternoon. It's our Health Watch replay here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, and our nursing staff, Lana, Donna, Jess, Jim, and Daniel. And then, of course, there's Joanne, delightful Dee, fabulous Fran, and our medical assistant, Sandra. I'm your host, John DeMasi. Thank you for listening, and we'll talk to you next Sunday, Health Watch, 8 till 9, here on Talk Radio 1210 WPHT. You take care.
This program is paid for by Innovative Medical Associates. All opinions or statements expressed on the program are solely those of Innovative Medical Associates or their guests and do not reflect the opinions of WPHT or Odyssey.